I'm Sarah Fanshaw, a postgraduate medical student at the University of Melbourne. My apologies that I cannot be there in person today. However, I'm excited to discuss the intersection of sustainability and safety in surgical practices, focusing our study titled Reusable Surgical Headwear has a reduced carbon footprint and matches disposables regarding surgical site infection, a systemic review and meta-analysis. We have no disclosures. From a global perspective, healthcare delivery is responsible for 4 to 10% of total greenhouse gas emissions. One of the largest contributors in this context is operating rooms, accounting for 20 to 30% of hospital waste, a consequence of the large volume of single-use items being manufactured and disposed of. In ANZ, the healthcare sector is also a significant contributor to our national carbon emissions. This context then sets the stage for re-evaluating our materials in our study, surgical headwear. Overall, we determined that there was insufficient high-level evidence in the literature prior to this review to define the most appropriate surgical attire in this context. Surgical headwear, commonly referred to as scrub caps or hats, plays an important role in personal protective equipment in surgical settings. It acts as a barrier between the surgical field and healthcare providers, is intended to preserve sterility and microbial contamination. In terms of types of surgical headgear, we have disposable scrub caps, which include both front caps and disposable skull caps, and then reusable scrub caps, such as cloth caps or personalised cloth caps. Our systematic review and meta-analysis aimed to explore the incidence of surgical site infection, or SSI, and environmental impact of reusable compared with disposable headwear. We defined SSIs as a diagnosed infection that occurs within 90 days of a surgical procedure, originating in the surgical wound or any organ or space that was contacted during the operating procedure. SSIs are among the frequent and expensive etiologies of healthcare-associated infections. Our systematic review and meta-analysis were performed using the protocol set out in the PRISMA guidelines. The steps followed are summarised in a PRISMA flow diagram shown in Figure 1. We searched from inception of the database to the 10th of December 2023. The search strategy included a combination of keywords listed. A supplementary search was conducted on April 1st, 2024, and no new papers were included. To be eligible for inclusion, studies had to report these specific outcomes. Included studies were those limited to being published in English, and data regarding study characteristics were extracted from eligible studies in a standard form integrated into the confidence database. From our search strategy, 9 studies were included in our systematic review. 6 were included in the meta-analysis that evaluated SSI incidents with over 45,000 procedural cases. These were then separated into pre-policy, post-policy, reusable and disposable headwear groups. As you can see, baseline characteristics were similar across groups. Our meta-analysis featured 2 studies comparing reusable and disposable headwear, and the other 4 were further divided into 2 subgroups. 3 studies featuring strict policies and 1 study featuring less strict or adaptive policies. This figure shows the stricter policies subgroup did not impact surgical site infection rates. Notably, the less strict policy subgroup displayed a significant reduction in surgical site infection rates, yet we did not see an overall effect that was statistically significant where P equaled 0.30. An exclusive sensitivity analysis found that removing any study did not change the overall effect size. An experimental study by Markel et al. Uncovered disposable bouffant hats had higher particle shedding, microbial shedding, permeability, particle penetration, and porosity than cloth and disposable skull caps. This is important because it supports the fact that reusable skull caps does not negatively impact overall surgical care or SSI rates. 2 studies compared the carbon footprint of reusable and disposable headwear. Life cycles assessments from both Cohen et al. And Agua et al. Studies found that the carbon footprint of single-use head covers were significantly higher than that of reusable head covers in the additional secondary categories ozone depletion, fossil fuel depletion, terrestrial acidification, and fine particle matter formation. Our primary focus was SSI rates and environmental impact, yet economic considerations appeared as an incidental yet significant finding. Argwell et al. Found yet you can break even using reusable surgical hats in 15 to 26 weeks. And Mosley et al. Highlighted the cost escalation associated with disposable attire due to policy changes. Our main findings are that the use of reusable headwear does not increase the incidence of SSIs of any kind, superficial or deep, and does not negatively impact overall surgical care. Policy changes does not alter SSI rates. Reusable headwear demonstrated significant lower environmental impact and economic burden. Surgeons' responsibility extends beyond the operating room to help implement these sustainability changes and assist in decreasing the environmental impact through both their actions and advocating for policy changes. It was estimated that strict policies resulted in a 10 to 20-fold increase in per person expenditure for operating room attire. Although our study is the first systematic review and meta-analysis on this topic, two recent literature reviews by Spruce et al. And Beesoon et al. Have been published that support our findings regarding SSIs. While comprehensive, our review is limited by its reliance on observational studies, which lack the robustness of randomized trials. This is not unexpected, as per our assessment, the overall risk of bias was minimized. Also, the limited number of studies addressing our study's focus restricts the ability to draw generalized conclusions. We argue that a change to reusable alternatives has the potential to decrease the environmental impact of healthcare and may have economic benefits for hospital surgical systems without compromising patient care. This is just one facet of sustainability we can implement. Research is currently being conducted regarding reusable drapes, fats, and many other broader implications. Surgeons have a responsibility to lead and advocate for these transformations today through altered surgical room practices and policy changes in order to develop a more sustainable healthcare system. Thank you for your time.